Let's start on this issue of the staff shortage. 24,000 more nurses and healthcare staff are needed by 2030 as Singapore ages. So just give us some insight as to what RMG is doing to address these shortages.
Well, last year, same time, there was a great shortage of all sorts of workers, nurses and just general medics and so on. So the rates were quite high. It has come off a bit. But I mean, we are very manpower intensive. Nurses, there's a global shortage of nurses. So we are keeping our nurses, we are attracting them, we are recruiting nurses from Philippines, India, Myanmar, wherever we could find them. In recent times, Singapore is losing nurses to Australia and New Zealand because they will grant them permanent residence. And we have highlighted to our government that they should be looking in the same direction, especially those who are good workers, who have been living in Singapore, working, and peaceful, peace-loving citizens. In the future, they will become.
So government needs to be aligned in terms of the policy. In terms of your conversations with MOH and the broader government, are they moving in that direction, Mr. Lee?
They are, because up to now we give S-Pass. S-Pass, you can bring your spouse, but not your kids. If you're PR, you can bring your children. And I think it's a lot more wholesome. And that's why we have to compete. That's a marketplace. So we need to do that. And we are also looking at how we could get into training of nurses. We are doing it in Singapore in a small way, but we might want to do it in a bigger way so that we can supply our own hospitals in China, in Singapore, and elsewhere.
So staffing has always been a challenge, especially highlighted during the COVID-19 pandemic. But as we showed, sir, we've seen actually that one of the big reasons why you've been able to maintain and even expand some of your profit margins is because you've seen lower staff costs. How are you folks able to lower staff costs despite all of these challenges? Did you have to reduce headcount? Were you able to negotiate lower salaries? Give us some insight if you can, sir.
A few things all happening together. From last year, there was grave shortage, so rates had to be high to find the workers. It has come off a bit. So that's one factor. And then now, in a little bit more settled environment, we are able to deploy them more effectively. So on the ground, our nursing leaders, our operations manager, they manage it very tightly. And we control headcounts very well. And we also use part-time. So we have a bank of 5,000 part-time workers whom we use in the COVID period. Now some of them hang on, continue to give us 4 hours a day or even 8 hours a week. But they are familiar, we'll take them and deploy them. Mm-hmm.